The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, TMD warriors. I am Tony Urbanic, and we are gathered here for the next episode of TMD Demystified on Tuesday. Today's date is July the 23rd, 2024. This is the 161st episode of TMD Demystified. I just throw that out because actually it's been going on then for roughly 3 years, or almost to the 3-year anniversary of TMD Demystified. Today, I hope that the topic and the presentation will be very interesting to you. I'll try to keep it as non-technical as I can, make it as simple as I can for you. But I find that this particular episode and topic should be very meaningful to everyone in dentistry. So I won't keep you hanging. The topic is topic is, what does TMD, TMJ have in common with Alzheimer's disease? Now, let's just a word about Alzheimer's. I'm sure you're all familiar with it, at least in passing. I've had in my family several aunts and individuals that I've known who have had this problem. It's a devastating disease. It has been only recently that it has been aggressively studied in the past 10 years or so, maybe less. What generally is known or promoted in the mainstream is it has to do with plaques developing within the brain, which are associated with Alzheimer's disease. And I may have a little more to say about that, but I am not out to give today a primer on cell biology, of which, fortunately, I have a degree, which allows me to generally understand the processes that I will be talking about, but I won't go deep, and I don't want to bore you. But let me start out by saying, what I have discovered. My discovery was, and the only discovery it wasn't the device itself. The discovery that I promote, talk about, and teach is that inflammation within the temporomandibular joint drives all the symptoms. Literally, directly drives these symptoms of TMD, all of the symptoms. They're all related directly to inflammation. Therefore, if you can make the inflammation in the joint decrease, you make the symptoms go away. It's not about how much you clench or grind or stop bruxism or what you do with the muscles or anything to do with myofascial pain dysfunction syndrome. It has to do with inflammation, and it is logical and literally proven by the fact that nonsteroidals do a great job in controlling TMD symptoms, but only for a short time, because that's the nature of nonsteroidals in any problem. It just has a limited effect on how much inflammation it can decrease, and then it literally runs out of steam. Doesn't do much after 2 or 3 weeks. So they're not effective for any length of time. But I'm not going to spend my time and your time just promoting the fact that if you get rid of inflammation, that is on multiple other episodes in multiple other directions, coming at the same problem, describing it the same way. But what I have known for a while, but I finally got around to talking with you about it, and that is the effect of systemic inflammation on Alzheimer's disease. Now, most of the dentist community is aware that inflammatory changes of the periodontal system, periodontal disease, periodontitis, is well known, well established, well studied by scientific studies, academic studies, statistical studies, showing that the greater degree or amount of periodontal disease that is present, the higher probability of cardiac disease, lung disease, low birth weight, and diabetes. Those four, and there are a few others, but those four are well known, well studied. That periodontal disease, which is nothing more than the incidence of bacterial infection on the periodontium causing what? Chronic inflammation. So, the cause of the inflammation, like any other inflammation, is some kind of attack on tissue, whether it be bacterial, viral, traumatic. They all cause damage, and inflammation is the body's response to damage in an attempt to heal, in an attempt to dissuade, in an attempt to delimit inflammation. But inflammation actually is what drives all of these diseases. Inflammation of the pancreas, inflammation of the coronary arteries, inflammation of the lungs, and it's the inflammation that drives the disease. So it stands to reason, it's logical that if you have a disease that creates chronic inflammation, it behooves you to decrease that disease, get rid of the disease, correct the disease, to decrease the chronic inflammation, which would have a positive effect on the probability or the actuality of cardiac disease, lung disease, low birth rates, and diabetes. Now, just within the past few years, some really good studies have come out which indicate that chronic inflammation, the cytokines derived from the cells themselves, the cytokine or the biokines, which are derived from the inflammatory cells, can get through the blood-brain barrier. You probably heard back in your dental school days on the basic sciences, there's such a thing as the blood-brain barrier, which supposedly has been known or factored to keep out bacteria and viruses and keep the brain tissues themselves away from problems or things that would incite or create damage. But the latest scientific data, analytical data, show that that is not true, and that the cytokines, inflammatory cells, and metabolites, biokines can infiltrate the blood-brain barrier and have negative activity on the brain cells. That being true, that being a fact, scientific fact, and I'll give you a couple references here in a minute, but you can Google it. You can do much better, faster than I can, Googling this fact and reading about it. And it's some of it's a pretty deep read. Yeah, I would suggest you get a little background in cell biology if you really want to fully gather the information and understand the information. But now that is a known fact, and the fact that we know that chronic inflammation derived from periodontal disease has effect on other diseases, bad diseases, Alzheimer's disease being a very, very traumatic disease for patients and families, it would behoove you to treat your periodontal disease to get rid of that chronic infection and chronic inflammation. It's chronic infection creating inflammation. So I want to make this clear, and I think this is misunderstood a lot in the dental community, It's not the bacteria that really causes the problem. It's not the bacteria that attack the coronary arteries of the lung. It's the inflammatory fluids and the inflammatory cells and exudates that are created by bacteria or viruses that cause the damage. So chronic inflammation actually causes the damaging effects. All right, with that being said, I wrote a episode or did an episode back in 6/22/23. One of the episodes was what does periodontal disease and TMD have in common? Well, what they have in common is chronic inflammation. That was episode 105, and it was recorded on 6/22/23, and it was entitled, What Does Periodontal Disease and TMD Have in Common? What they have in common is chronic inflammation. And in that particular episode, I direct you to it because I found it kind of fascinating. What I did is I calculated the amount of inflammation, chronic inflammation, derived from the root structure of 28 periodontally involved teeth. I calculated the surface area in the entire surface area. Theoretically, if you had the entire surface area of 28 chronically inflamed teeth, which doesn't happen in periodontal disease unless you lose a particular tooth, but you'll never see 28 of them fully involved with periodontitis, but you'll find many. But what I calculated was, because the surface area of the temporomandibular joint is so large, it's a small joint, but because of the circumflex nature of the synovial membrane. Remember, it's basically superior joint space, inferior joint space with a meniscus in between. It magnifies the surface area within a joint tremendously. So it's a small joint with a large surface area of synovial membrane, creating synovial fluid, which includes the meniscus. Well, I calculated in this and derived in this episode, number 105, that the surface area of the temporomandibular joints, if inflamed, are greater than the inflammation created by periodontally involved 28 teeth. In other words, you'll get more inflammation from the temporomandibular joints than you will from periodontal disease on a area by area basis. I would assume that you can do further calculations on how much chronic inflammation is from whatever square centimeter that you're calculating. And I'm sure there are other variations, and it's just a rough calculation. I mean, it's a rough calculation. But the point is, you get a lot of chronic inflammation coming from the temporomandibular joint. All right, if you follow my reasoning, you probably already know where I'm going with this. If it has been proven that chronic inflammation derived from periodontitis, periodontal disease, has huge effects on other areas of the body, now including the heart, the lungs, low birth rates, and diabetes, and now including Alzheimer's disease, it would behoove a patient with chronic inflammation coming from the temporomandibular joint to decrease it, get rid of it, fix it, diminish it. However, the best way would be to diminish it. Of course, in our industry, frequent visits to the dentist or the hygienist and doing proper hygiene motions, getting your teeth clean, deep scaling if necessary, removing a tooth that is not salvageable is the best and frankly only way of handling chronic inflammation within the oral cavity associated with periodontitis. But using a device, a non-surgical device that unloads the temporomandibular joint, which does nothing more, nothing less than decrease the inflammation in the joint, driving all the TMD symptoms, would be equally efficacious, good word, equally efficacious in protecting one's body from heart disease, lung disease, low birth rate, diabetes, and now Alzheimer's disease, of which we're learning more. And again, and as I read several articles, the incidence of Alzheimer's is increasing rapidly. Now, I have some opinions about why that might be. I'm not even going to share them with you, but they have to do with diet and other things. But I think that, I mean, it is easily known and proven that the incidence of Alzheimer's is increasing rapidly. So, being good doctors and dentists in our profession, I think that when you talk to a patient or your patients about their issues, and knowing that 45% of females have temporomandibular joint symptoms, most of those 45% have been misdiagnosed as their symptoms being something else. That misdiagnosed as migraine headaches or Meniere's disease or ear infections are the three most common misdiagnoses when it's actually TMD. Again, refer to prior episodes. So, I really made the point, but I want to just carry it on just, a little bit further. So we're getting into an era, and you can't deny it, where the doctors, both physicians, physician types, physician assistants, nurse practitioners, other ancillary healthcare providers, and we certainly as dentists fall into the category of healthcare providers, are taking and expected to take a much more proactive action in preventing diseases rather than fixing things when they happen, which is, obviously the way it's been for the past 100 years. You have a symptom, you have a problem, then you go after a fix. Whereas for social reasons, economic reasons, ethical reasons, it is much better to be proactive than reactive in handling medical care. And, it's promoted by insurance companies, so I think they do it for their own reasons, because I don't really think insurance companies are all that interested in decreasing the quantity of disease, although they want to make it look like that. But as doctors, we should be. As professionals, we should be. As groups of doctors in the ADA and the AMA, we should be as interested in preventing disease as we should be in fixing symptoms and fixing disease. And this, now, as I outlined to you, is an excellent example of how you can portray to your patients your interest in their well-being long before they actually have a disease, by doing a simple exam. I mean, not everybody has TMD, but I can tell you, you can rule it in or rule it out very simply. First of all, collect symptoms. Do you have any of the routine symptoms of TMD, which are, I'm going to run down them again, which are frequent or recurring headache, earache, jaw pain, neck pain, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, various kinds of locking or inability to open, and of course, ringing, fullness, dizziness, which is Meniere's disease. But those are the well-accepted, well-established symptoms of TMD. And by you or your hygienist or even an assistant going through a health history and asking, do you have any of these symptoms, regardless of what everybody else says about them? I mean, I always tell my patients, don't confuse it with what some other doctor said is derived from that symptom, what their diagnosis is. Just, do you have the symptom? Run down the symptom list, check off what symptoms they have, and then press on the temporomandibular joints from the open and closed position. We have a video on that, how to do that. It's quite simple. You don't have to be a doctor or medical type to do it. The patient can do it, but open widely, press firmly into the glenoid fossa, bite together quickly. If it hurts, the joint's inflamed. If the joint's inflamed, that's the definition of TMD. The objective then is to get rid of the inflammation, not only for the symptoms that it creates, but for the projected possibility of developing other much more morbid diseases than just headaches 3 times a week, which is a bad disease in itself, and pain drives people in. But if you can establish with your patients that you are trying to help them and make the diagnosis of inflammation within the joint and call it anything you want, I think, temporomandibular joint disorder is fine. Everybody calls it TMJ, as you know, which is just the name of the joint. And it's not disorders, plural. I made that point several times. It's one disease, inflammation of the joint. That's the disease, inflammation of the joint. It's not a multitude of disorders, and they try to make it a multitude of disorders by culling out each and every symptom as a disorder. That's where the confusion comes from. So if you followed me along this far, it's an advantage for you, the practitioner, or anyone in the industry, to promote the idea that you can help the patient not have significant morbid diseases by decreasing inflammation within the temporomandibular joint. Quite easy to do. So if you are interested in learning how to do that by unloading the temporomandibular joint with a simple device and protocol that actually decreases the inflammation in the joint adequately to decrease all the symptoms. And then, obviously, as we now know, systemic inflammation can get through by way of the cytokines, inflammatory exudates, can get through the blood-brain barrier and have a effect. We don't know how much effect. There's a lot of the part of this narrative that we don't know. And there are a lot of smart people studying it. But we do know that exogenous inflammation created other places in the body can enhance or create or help induce Alzheimer's disease, along with the other diseases noted. This is a huge problem. It's a huge opportunity. It's a huge advancement in understanding. And I would hope that those listening to this episode think about it a little bit as it might apply to you and your patients and how you might use this information. But if you want to learn how this device works and how we can help you develop a significant number of patients treated in your practice with a very simple oral device that unloads the temporomandibular joint adequately to decrease inflammation in the joint, therefore decrease systemic chronic inflammation. You can see a lot of information on our website, www.urbanictmj.com. If you want to be a network provider, because the device itself is licensed and patented, you can actually take our online course. It's about 2.5-hour online course and become licensed to become a provider for this service and device, which is now very high-tech, CAD/CAM created, 3D printed, and very effective, validated by our independent university study, validating our claims, the success rate, depending on how you define success, and there are various ways to define that. Patient satisfaction is 85%. That's over all patients with all types of symptoms. But as far as decreasing symptoms, we've been noted that literally 95% of patients have significant decrease in their symptoms, significant decrease in 90 to 100% diminishment of their symptoms. And this has all been validated in the study. And the study is available if you'd like it. And you can get the study by contacting me personally at tony@tmjservices.net, or you can get access to the study on our website. All right, I think that's enough. Hopefully this will be a little shorter than the average episode, but I think I've made my point. I would like you to think about this. Oh, and by the way, the two studies that I recently studied was this one here, which is Frontiers in Immunology, which is a textbook, January 2022, and a very large, complete tome on the issue from the National Institute of Health, author manuscript in Neurobiological Aging in January 2014. This paper has 635 quotes, papers that have been quoted in putting together this paper. So the bibliography is quite lengthy, and I think you can find everything you need either on these two papers or on the internet. With that being said, I invite you to tune in, listen for the next episode, which I will record on next Tuesday. With that being said, I am Tony Urbanic, and this is TMD Demystified.